Hey Freedom Lovers, this is Dr. Peterson, Pierre with America's Frontline Doctors, bringing you today's Daily Dose. There's now a simple way to find out whether your child's pediatrician actually believes in medical freedom. On December 30th, the Centers for Medicare and Medicaid Services sent a letter to providers announcing significant changes. One of the most consequential shifts in decades. The federal government is ending bonus payments for childhood vaccinations. Yes, they've been getting bonus payments. Vaccinating kids has been very profitable. In 2025, Medicare paid doctors about $45 for each COVID-19 shot given to a child. Administer it at home, and another $40 was added. That's $85 for a single dose, supplied free by the federal government. And that's before insurer bonuses, which reward high vaccination rates with payouts that can run into the thousands. So when you stop incentivizing the mass vaccination of children with shots they don't need, and in many cases shouldn't receive, you'll get less of that. That change alone will save lives. CMS also signaled what's coming next: protection for religious exemptions and new vaccine measures that track whether parents were informed about vaccine choices, safety risks, side effects, and alternative schedules. It's shocking this wasn't already happening. That just shows you how corrupt our system is. In plain English, the federal government is beginning, finally, to restore medical freedom that Americans have been denied for decades. This is guaranteed to infuriate the AAP. For years, parents have been robbed of informed consent. Doctors routinely refuse to disclose the real risks of the shots being given, whether a child actually needs them or whether a slower alternative schedule might reduce harm. Consider the numbers. The CDC's current immunization schedule exposes children to up to 72 injections. In the 80s, it was 7. If vaccines were as safe and effective as claimed, today's children should be the healthiest generation in history, right? Makes sense if we follow logic. Except they're not. Far from it. Over the past 20 years, chronic conditions in children have risen by 30%. American children are 80% more likely to die than their peers in other developed nations. 74% are too sick to qualify for military service. Autism, once 1 in 2,500, is now 1 in 36. This isn't natural. Something external is driving this epidemic of childhood illness. But there's one suspect we're told not to examine: the vaccines on the CDC schedule. Couldn't be the cause. Parents who ask questions are shamed. Data that challenges the narrative is buried. In 1999, the CDC conducted an internal study examining possible link between the hepatitis B vaccine and autism. According to RFK Jr., the research team led by Thomas Verstraeten was shocked to find a, get this, 1,135% increased risk of autism among vaccinated children. Public never saw that study because the CDC buried it. A similar thing happened in 2020 when researchers at Henry Ford Health completed a study tracking vaccinated and unvaccinated children. By age 10, 57% of vaccinated children had at least one chronic disease. Among the unvaccinated, that number was 17%. Vaccinated children had 329% more asthma, 203% more atopic disease, 496% more autoimmune disease, 453% more neurodevelopmental disorders, including 228% more developmental delays and 347% more speech disorders. Among the unvaccinated, there were no cases of brain dysfunction, ADHD, learning disabilities, intellectual disabilities, or tics. That's staggering. That study was never published because the researchers were too afraid of the blowback. Many pediatricians will put up a fight because for them, it's not about informed consent. It's about obedience to institutions, to ideology, and of course to profit. Ironically, they're so devoted to the CDC schedule that they ignore the CDC's own allowance for alternatives. It doesn't make sense, but it sure makes money. So how do you know who to trust? Well, simple test. Ask your pediatrician about alternative vaccine schedules. If they're willing to discuss fewer shots at a slower pace, you're dealing with a real doctor, one who believes in science and medical freedom. If they shut you down, scoff, or react with outrage, you're not dealing with a partner in care, you're dealing with an enforcer. Find a doctor who respects medical freedom and take your child elsewhere. Ladies and gentlemen, only the truth will set you free. Stay tuned for the next Daily Dose.